So why do eye doctors do LASIK eye surgery if they haven't gotten it themselves? Ooh, that is a good question. Hey, this is Dr. Allen here from the Dr. Eye Health Show. The channel helps you learn all about the eyes, vision, and finding the best vision products. So if you're new here to the channel and like learning about the eyes, then hit that subscribe button down below so that you don't miss any of my future videos. Now, this video is kind of special. We're actually be talking, really answering some of the questions that you and other viewers have asked on across all the different videos that I've made. And so yeah, we're going to try to answer some of them here. Okay, Aphrodite, yeah, it's me. Oh, I like that name. So Aphrodite, do I have to clean my contact lenses every day, even when I'm not wearing it? I use bi-weekly contact lenses. So yes, when you are using contact lenses and you clean them, disinfect them, usually if you read the back of the bottle of whatever disinfecting solution you're using, it'll actually say how long you can still leave your contact lenses in that solution. So read the box, whatever you're using. I think Opti-Free Pure Moist, which is what I usually use, I'll have to double check, but I believe it says you can use that up to 30 days. George Soros asks, can you make a video about CRT orthokeratology? Absolutely. I'm hoping to actually make a video on that, but I'm actually trying to loop in another doctor friend of mine who fits a lot of orthokeratology lenses, and being that, I fit a lot of them, but he fits just even 10 times more than I do, so I think it'd be kind of cool just to have another guest on the show and talk about a little bit more there. But yes, orthokeratology lenses, if you're someone who's never heard of that, they are fantastic. It's kind of like an alternative to LASIK, so that you can actually wear contact lenses at nighttime and they actually morph the surface of your eye, and actually the next day you take out the lenses and so you're walking around the day without contact lenses in and you can see great, but then toward the end of the evening the surface of the eye kind of reshapes back to its normal shape, so things get a little fuzzy, and then you just again put the contact lens in overnight and you repeat the process, and it's an excellent alternative for a lot of people. Is it true that you can clear the scratches on the glasses using toothpaste? Honestly, I personally don't know that this actually works. I have tried using toothpaste to clean like CDs and stuff like that, and I don't think it works at all. No, I'd probably guess not. Fabiola asks, can you make a video explaining about different types of retinal vein occlusions? Well, the answer to that is yes. I hope to make a video about that at some point. However, I'm not sure how many people are specifically looking for that, but I think it would be a really interesting video. A retinal vein occlusion is, at the most basic level, a stroke in the back of the eye, most commonly from elevated high blood pressure. So just like people think of a stroke happening in your brain and causing a lot of problems, potentially even death, and actually a stroke can happen in the back of the eye as well. Usually an eye doctor will see something as a branch retinal vein occlusion. That's where a single branch of a vein basically gets kind of clogged up because of the way the artery is crossing over the vein, and that causes a backup of pressure and it causes the vein to burst, leading to blood and fluid building up inside the eye, and that can actually cause the retina to swell, and that swelling of fluid can actually cause damage to the retina. Even more serious is something called a central retinal vein occlusion. That's basically where the entire central vein going to the eye gets blocked up, and that actually ends up with a lot of blood in the back of the eye. We actually call it blood and thunder, and this can actually lead to not only decreased vision, could actually put a great risk of developing a very serious type of glaucoma. So whenever we see this in the clinic, we have to act fast. But yes, Fabiola, of course I will make that video for you at some point. It may take me a little bit to get to it, but yes, that would be a really interesting video. Basic point for everybody who's seeing this: if you have high blood pressure, take your medications and try whatever you can to change your lifestyle so you can decrease that blood pressure. You don't want to be getting a stroke in your eye. So why do eye doctors do LASIK eye surgery if they haven't gotten it themselves? Ooh, that is a good question. First of all, when it comes to LASIK, there is kind of a lot you need to understand. When an eye doctor sees somebody for LASIK, even another eye doctor, we have to consider, one, are they a good candidate because of the power of their eye? And I personally do fit into that. I can get LASIK. Two, we have to see if their cornea, the surface of their eye, is thick enough. That again, thankfully, my cornea is thick enough per the power of my prescription, so I'm a good candidate for that reason. But number three is really motivation. And is somebody who's going to have an evaluation for having LASIK eye surgery, are their expectations with the surgery in the realm of realism? And that's something that a lot of people have trouble with. They go in to have a LASIK evaluation and they think that, LASIK will just be this miracle cure for them, that they'll be able to see better than 20/20. And that's not realistic. At the same time, some people think, I'll get LASIK and then I'll never need glasses or contacts again. That is also not true. For multiple reasons. One, LASIK can only get your vision as clear as like your glasses and contact lens prescription will get you. So if you're somebody with a lazy eye, like amblyopia, that's more of a cortical thing going on in the brain and less a problem with the correction of the eye. So yeah, they can correct it. So maybe you're not as, they don't have to rely on glasses as much, but you're still not going to see quite as sharp as an eye that doesn't have like a lazy eye. So when it comes to someone like myself, the personality I have just requires to have really sharp vision all the time. If I'm not seeing 20/15, I'm like irritated by it. And knowing that with LASIK eye surgery, they usually, on most times, can get people to see 20/20 a lot of the time. But they can't guarantee they're going to get you to see 20/15, which is something that I'm already seeing with glasses and contacts. So for that reason, I don't think I would be super happy getting LASIK. On top of that, one of the more common complications from LASIK eye surgery is more of a dry eye sensation. And I already have at least some level of dryness on my eyes. So to take that risk of going through getting LASIK to not see as good as I do with contacts and then have my eyes even more dry than they already are, it's just not worth it. But at least when it comes to LASIK for myself and other eye doctors, I know that a lot of eye doctors have had LASIK and they love it. They really do enjoy it. There are some doctors who, like myself, have not had LASIK, and it could be either for the reason that I just said, like I know that I'm not the best candidate for that procedure, or it could be because I know one of my mentors in school, she said, I've seen that less than 1% of people that have had complications, and she just doesn't want to take that risk. It is a little bit of a gamble. There's truth with any sort of surgery that things can go wrong. It's very rare, like very, very rare with LASIK, but there are some people who have bad outcomes. So that is a kind of a risk that your eye surgeon will discuss with you if you're willing to take that very, very small risk. Okay, Canadian Kid asks, can you do your own PD measurement, and why do most optometrists not include that with their eye exam? This is actually a really good question. We're actually discussing this at my own clinic the other week. A PD measurement is your pupillary distance between one pupil and the other, and is generally used for corrective lenses when prescribing glasses. It's actually, historically it used to be part of an examination because opticals used to be one-stop shops. You see the doctor, they fit you with glasses, and that includes the PD measurement, and then they make you glasses. Now these days, there's a larger separation between what eye care professionals do in the actual medical clinic versus what's sold in the optical versus glasses. So there's like this separation between glasses and medicine, where it used to be all kind of intertwined. So a lot of doctors now, we don't measure the PD during the examination because there's really no point. It's not useful for us to figure out what's healthy for your eyes and what the right correction is. That's something that really depends on the glasses you're getting and what type of glasses you're getting. If you're somebody who's just getting reading glasses, then the PD measurement, your pupillary distance measurement, is different than if you're just looking in the distance. And it also depends on little micro things. Yes, there are ways that you can measure your own PD or pupillary distance again at home, whether you're using just kind of a ruler, a centimeter ruler, and you're looking in the mirror. There's certain guides online. Actually, I should make probably a video on that. But there's also some different apps and things like that out there that you could use. In general, though, when you go to see an optician, they don't just measure it with a ruler, a centimeter ruler. If you're really into a specific optical who takes things seriously, they actually have a machine or a pupillometer that'll measure not just where your pupil is on one right eye and then compared to your left. It actually measures them individually, because most people's eyes aren't perfectly equal distance with their nose in between. They're actually a little bit more to the right, a little bit more to the left. So you may have one that's like 34 millimeters on the right side and like 31 millimeters on the left side, and that'll change where your glasses are sitting. And if they're not sitting the right way, then that'll throw off the whole prescription. So yeah, if you were looking to get really exact measurements, then yes, go see an optical. Question of the day, what other questions do you have? Please go ahead and comment in the section below, or if you have any other video ideas or topics you'd like to see me cover. I do have this long list of videos that I'm trying to work through. It does take me a little bit of time because right now I'm kind of a one-man team at the timing of this video. So yes, thank you for understanding, and thank you so much for your contributions and being part of this community. Otherwise, for this video, if you liked it, give me a thumbs up, share it with a friend if you got any sort of value out of this and you think they would like to see it. Otherwise, if you'd like to catch other cool videos from Dr. Eye Health, please check out the videos coming up next. Keep an eye on it. Talk to you soon.